Hello everyone. So in this video I'm going to talk about the investigation, differential diagnosis and treatment of TM, that is transverse myelitis. So let's start. First we talk about the investigation. So in investigation we first do a CSF analysis. Okay, in CSF analysis it shows a elevated IgG index. Okay, then we do MRI and CT scan of spinal cord. So this shows a cord swelling and inflammation and around tissue and nerves are damaged or not. So we can go for MRI and CT scan, and we can do a palocystosis. In that, generally elevated abnormal size of lymph nodes we can see. Okay, so it shows a elevated abnormal size of lymphocytes in CSF. So this type of investigation is for CSF, second MRI and CT scan, third palocystosis, and fourth we can do a lumbar puncture. So this is the investigation process for the transverse myelitis. Next we talk about the differential diagnosis. So in that Guillain-Barré syndrome, which is same like a transverse myelitis, but difference that is in that areflexia is present. Okay, areflexia. Whether in transverse myelitis hyperreflexia is present. Then lower limb જે છે એ પ્રોગ્રેસિવ એમાં ડેમેજ થશે and upper limb and lower limb both affect થશે. But in transverse myelitis lower limb is more affected. So this is a difference. Then Babinski's then no bladder and bowel dysfunction mostly. Whether in transverse myelitis bladder and bowel dysfunction is seen. And other differential diagnosis, that is multiple sclerosis patient, NMO. NMO means neuromyelitis optica. In this condition, the optic nerve and the spinal cord both are affected. So that affect eyes. Okay, so it is a neuromyelitis optica, and other that is any tumor and epidural abscess. So these are the differential diagnosis of transverse myelitis. Now last we talk about treatment. In treatment we discuss a medical and PT, two management. So first we talk about the medical management. Okay, so we give corticosteroids. Okay, so generally corticosteroids, it's prevent a recurrent attack. Okay, it prevents a recurrent attack of transverse myelitis. This corticosteroids we can give intravenously. Okay, intravenously in acute case. Then second we talk pain management. So pain management we give analgesics, and then anti-inflammatory drugs. Okay, which reduce spinal cord inflammation. Then fourth we can give immunosuppression drugs, because in autoimmune disorder it is very common. So immunosuppression drugs we can give. Then laxatives and stool softeners. So it given for the bowel dysfunction. Then we can give antispasticity drug. Antispasticity drug we can given because spasticity is present. So generally we can give a baclofen, which reduce the spasticity. In pain management analgesics, so we can give a ibuprofen, okay, and naproxen sodium. So these all are about the medical management. Next we talk about the PT management. So PT management, I tell goals, and from that you have to decide exercise and plan. So decrease pain, first goal. Then increase strength and endurance of muscle. increase coordination and balance improve, because if it is a complete transverse myelitis, so all these things can affect. Then decrease muscle spasticity. So for fifth, that is reduce muscle wasting in paralysis region, in paralytic limb. Okay. Then care of immobilized part. Okay. Why? Because it prevent infection. And then we can manage your bladder and bowel control. Bladder and bowel management. So decrease pain, we have to give modality TENS. Okay, IFT we can give. For increased strength and endurance, okay, we can give general first passive range of motion, then we can further active assisted, active and resisted with dumbbells, with theraband. Okay, then improve coordination and balance, we can give a non-equilibrium and equilibrium uh, exercise. Okay, then we can for decrease muscle spasticity, we can give ice pack, massage, splinting, some positioning. Then for reduce muscle wasting in paralytic limb, okay, so we just apply a passive movement of that all limb. Then care of immobilization, so you have to frequently changing a position, okay, so that prevents infection and pressure sore and ulcers and etc. For bladder and bowel management, you can give a pelvic floor muscle strengthening exercise. For urinary incontinence and stress incontinence, you can give IFT modality. So this type of PT management you have to write down in the transverse myelitis. Thanks for watching.